Hello everyone, and welcome to another webinar organized by Neuro. My name is Beatrice, and I'm the product manager for Neurofeedback and QEEG solution at ENT. And today, continuing our series on neurofeedback, I'm glad to be hosting the webinar on analysis of BrainMaps and other EEG parameters to individualize neurofeedback, which will be presented once again by Dr. Philipp Heiler, who founded his medical practice in 2016, and he specialized in EEG, QEEG, and neurofeedback. Over the years, he has worked with hundreds of patients and is collaborating with the excellence universities of Munich. To improve the diagnosis and treatment of his patients, he founded the company BrainBoost to develop the neurofeedback software called BrainAssistant, and use innovative technologies like AI to learn more about the human brain. So today this is going to be a highly interactive session with a combination of scientific presentation and also practical content with a demo. There also will be an expert Q&A panel at the end of our session. And in the course of the webinar, you also have the option to type your questions, which will be addressed at the end of this session. So, Philipp, once again, we do appreciate you accepting our invitation, and we are looking forward to hearing your presentation.
Yeah, thank you very much, Beatrice. So I'm happy to be here again. After the first webinar was, I guess, well received, but we got the feedback that it was a lot of content. So, we thought we could add 2 additional webinars. One today where we will talk, or where I will talk about BrainMaps and QEEG, and specifically which parameters I'm looking for when I customize neurofeedback protocols. I will also give you a sneak peek of a new feature that we are developing currently for the BrainAssistant. And I guess we'll also do a bit of a live demo, but I have prepared some slides to go over it and make sure everybody understands what's going on. So I'm taking the screenshots directly from the BrainAssistant. I also have to apologize. I have a little bit sick, so I had to go to a different room than we originally intended. So I have a second screen over there, so I sometimes have to look a little bit like this, but I'm sure we will get it done. All right, let's start right away. As Beatrice mentioned, if you have any questions, put them in the chat. They will usually not be visible for everybody, so they will be at the moderator's team, and then they will check the question and either put it at the end of the session or right in between and tell me about it, and then we can also do it right away if it fits the topic. Disclaimer, I want to keep this very transparent. So I'm personally, as Beatrice said, one of the founders of BrainBoost. So the software I will be showing, or the reports I will be showing, are based on our software, which we develop and also sell, and also collaborate with ENT Neuro. Still, I would say the parameters I'm talking about are very transparent and not specific to our software. So you will be able also to build your own analysis tools and use them. So I would say that's okay. And also we are offering trainings with the BrainBoost Academy. So I'm also putting this out there that we are offering paid trainings as well. But I think, again, today I will focus on research-based content, so we should be fine. Okay, generally, I want to target this a little bit towards the topic of neurofeedback. I have experience in neurofeedback for almost 9 years, so I've done thousands of sessions. We are, at this point, only working with amplitude training or frequency band training. I've tried many other things. We did the C-score training, we did Loretta-based trainings, we did ISF trainings, ILF trainings, so we did all kinds of neurofeedback, but we stayed at the amplitude or frequency band training because I think it's well understood. There's a lot of research for it, and every time it's clear for me as the practitioner what I'm doing and what's happening, and also it's easy to explain to a client or a patient. So as research shows, and also as our experience shows, I would say I mainly think in 3 main areas of the brain that are clinically relevant. We have the frontal lobe region, which consists of FP and F positions. So we're usually working with the 10-20 system. So that's usually the positions that I'm referring to. So we have a frontal lobe which is executive functions and motivation and also rational thinking mainly. Then we have the sensor motor strip or sensory motor cortex, which hosts a lot of motor movement and primary sensory processing from the body. It also seems, at least that's what some research suggests, that also connection between thalamus and cortex can be seen in the EEG here. So it kind of projects to the EEG in that area, which explains why a lot of neurofeedback trainings are done on these positions, not only improving motor skills, but also emotional regulation and focus. So this is a very important area from a neurofeedback perspective. And the third area is more the parieto-occipital lobe, or rather lobes. It's actually two lobes from an anatomical point of view. So the P positions and the O positions, this is where we have a lot of sensory processing, but also reading and writing, spatial processing, and visual processing. So I would say we have these three bigger regions that we say, okay, we have the frontal lobe, which is more associated to affective disorders, focus, and so on. We have the central strip, which is for motorical and emotional regulation. And also, I would say it's just for a general training of brain activity regulation. This is a good first step. And we have the parieto-occipital lobe, which is more connected towards sensory processing and calmness, relaxation, and regeneration. I will circle back to this, but just to keep that in mind, that these are, in my opinion, three focus areas that we are usually working with. All right. So let's say a typical way to analyze brain data. So maybe let me take a step back there and dive right into the BrainAssistant real quick. I just have to see, we did an update and it kind of like seems to have screwed up a lot of things. So let's see if this works now. Oh, it still looks very bad. Okay. Sorry about this. I will change the client to myself. All right. Let's pick this one. Okay. So, okay, now we have the wrong notch filter. So now it should be fine, or not. Let me reopen it. Okay, now we're good. So this was actually done with a 64 channel cap, which is not usually necessary. So please don't mind some of the artifacts here. We were doing some testing for the implementation of that. But generally, the regular process of going from EEG to BrainMaps would be to look at the EEG, have a certain, sorry, I'll get back to this, have certain segments. So we usually have an eyes open segment, resting state, and we have an eyes closed segment, resting state. That's what we usually work with. And then we generate brain maps. So in the BrainAssistant, you can just say, I want to add some brain maps. So we have some relative amplitude and power, and we have the absolute amplitude and power. And we do also have the option to do Z-scored brain maps. We went, or we talked about Z-scores last time, so I'm not going to go into too much detail for now. Let's just say I want to add some brain maps with a certain power spectrum. So I can add them and we go for the default frequency bands, and then I can readjust the scale to see what's going on. This one will just present me the absolute power. So this is in microvolts squared. That means I will see the value, for example, of the alpha power, and it will not be influenced by any other frequency band. So this will just show me alpha power, basically. If I add the relative power, this will show up here. This one will give me a percentage scale, because the relative power is calculated by comparing a certain frequency band. In this case, it's the alpha band 8 to 12 hertz, and it compares the power of this frequency band to the 1 to 45 hertz full EEG. So it's basically what power percentage of the full EEG does alpha have in this case. So that means I will get more of like a weight comparison between the different frequency bands, but that also means that they will influence each other. So we need to keep this in mind, that if one frequency band shows relative high alpha, this can also be due to, for example, having a relative low delta here. So, or if we have, for example, artifacts in delta or some other frequency band, we might have lower values than we actually have in other frequency bands. So these will influence each other. Both of these analysis types have advantages. So in neurofeedback, we usually work with the absolute amplitude or absolute power, either way, usually not with the relative power, not yet. Or we build ratios to kind of like cancel out things like, okay, somebody has a very high alpha amplitude, but they do have a thin skull bone, for example. So it would be higher than it actually is, or higher in comparison to other ones. So with the relative, since we compare the alpha to the full EEG, this would cancel out this measurement issue. So we could do it the traditional way and have a look at different brain maps, do different settings to kind of analyze the brain maps. Also a little side note here, it's not really possible to have one view of all the brain maps that make sense, because either I scale it. So for example, now I have the scaling option that all the scales are the same, so I can compare each frequency band to the other one more easily. But it means I'm losing a lot of detail, for example, on low beta or gamma or alpha 1. So on the low values, I lose detail because it's now just blue and this one is just red. So, but it's easier to compare the brain maps with each other. So I will always have to adjust and see, okay, now I have a good view on delta, now I have a good view on alpha, and so on. So it means I will not be able to capture all the details in one screenshot. So we could go through the brain maps, do different settings, and then we do different, take notes or do different analysis of these, of certain areas that we're looking at. And then we can figure out what to do with it. So to make this process a little bit more simpler, we developed a system where we take into account 12 different scores that I have found very interesting for neurofeedback. And these can actually be done by creating an automatic report. So usually you just go here and then you can generate the automatic report. And I will show you what's in that report in a second in my presentation. So the idea here is that we pick certain settings, certain parameters, analyze them, and still give you an overview on how they look like and present you the right brain map for that. So let's give you an example, going back to our presentation. This is the score overview. Sorry, it's in German here, but we have it in English. So if your BrainAssistant is set to English, then this will automatically be generated in English. These are the two languages that we currently support. So we have a variety of scores. I will go over them now one by one and tell you why I think this score is relevant. So first one, to give you an example of what I'm talking about, the focus score theta, that's how we call it. It is the relative theta power on CZ and FC, because there's research that suggested, and we also have learned that during the neurofeedback, that let's say a central line increased relative theta power. So we're going for the relative theta power to cancel out, for example, things like thin skull, thick skull, whatever, things like that. Also makes it easier to understand like how much percentage-wise does theta actually represent for the full EEG. So we take the relative theta power on ZZ and FZ, we average it, and then I will now go to the page as it looks like in the brain report. And then we will give you the base value. This is the actual calculation. So this means we have a relative theta value of 40.9. So we have already developed certain cutoff points and kind of give that a score, right? So we are trying to make it easier for you to decide, is that okay, is that medium, is it high? The way we are doing it right now is this is based on research and analysis of the data sets that we already have in our practice. And that means it's over 1,000 full EEGs and over 10,000 neurofeedback sessions that are currently in our database. We did way more, but this is how many we have done since we have the BrainAssistant software. So we do have a scoring system to show you, is this very high or is it not high? So the base value of 40.9 will get, in this case, 100 score, which is red. We will, in the next updates, switch this because this was a feedback from users. They said 100 score sounds like it's good, but it's actually not good, from speaking from good or bad perspective. So we will switch this. So the red area will be the 0 and the 100 points will be in the green or blue area. But anyways, this shows you this is above our threshold. To keep it transparent for you, we first of all have in every report that you generate an explanation of what this score consists of. So as I said, we are trying to keep this scientific and transparent. So we have the relative power of theta brainwaves at frontal and central regions of the brain. And then we have a little text that is picked accordingly. So our cutoff is 25% because we have observed that people with more than 25% theta, relative theta power with eyes open usually have issues with concentration, focus, rumination, and so on. So that means we give you an indicator that this might be too high. And we do the BrainMap, specifically the eyes open segment, relative power of theta with a scale that is already adjusted to our score range. So that means if this is very red, it shows you there is a lot of theta. This is why it's above the cutoff. So instead of going through doing all the brain maps manually, screenshotting them, putting them somewhere and writing some text, we do this automatically and kind of pick the specific value, put on a score and show you the corresponding brain map and even pick 1 out of 3 text segments. So we have 1 text that is for the green, 1 for yellow, 1 for red, to keep it very transparent with you. We're also trying to phrase it in a way that it doesn't sound too non-scientific. So we're trying to rather explain, and we kind of say, okay, this can be associated with this or that. But of course, we can never say this means you have ADD or ADHD or something like that. So the first score I'm looking at, or one of the scores we're looking at corresponding or regarding focus, is the relative theta power on FC or CZ. So either frontal lobe or central strip is what we're looking at. The next one, because it is also very common in research, is the theta beta ratio. So we're doing the same thing on CZ and FC. We're doing the theta beta ratio. That means we're going for the theta power and divided by the beta power. So this is, I would say, similar to relative power, but it's a little bit different, and some people just prefer this parameter. So we also included it in the report, but it's quite similar to the one I just showed. So what we're doing, and this is maybe the first take home, we're looking for excessive theta, specifically in frontal and central regions. Next is the focus score alpha. We're looking for excessive alpha power because we have observed that some subtypes of ADD or ADHD do have excessive alpha. These are often people specifically with emotional regulation issues. So they do have strengths often in creativity and in sports, for example, but they struggle to stay focused, and they also struggle with emotional regulation and self-doubt and negative thinking and things like that. So this is what we're looking for. Again, in this case, focus score alpha. And he is also the relative alpha power of these 3 positions. And in this case, it's very low at 14.9%. So anything below 20% is what we would not consider excessive. So that's why this score is in the green range. And as you can see, we present the corresponding brain map again with a fixed range. And you can see it's blue and greenish, which means this score is not excessively high. The last focus score is the alpha 1 to alpha 2 ratio on PZ and CZ. So we have learned that the alpha 1 to alpha 2 ratio can specifically with ADD, but also specifically with sensory processing disorders or auditory processing disorders, Also for dyslexia, this can be a marker to be observed. So sometimes you do see QEEGs that the people report ADHD symptoms, but they do not have excessive theta as we would expect, and the theta beta ratio is kind of normal, and even the alpha is not excessively high looking at the full alpha band. But taking a look at the alpha 1 to alpha 2 ratio, which would also correspond to a lower alpha peak frequency, we can see something there. So let's see in our example, we would usually expect the alpha 1 to alpha 2 ratio to be somewhat balanced, which would give us a quotient of value of 1. In this case, it's 2.6. That means there's much more alpha 1 than alpha 2. To help you understand this more easily and visually, we have also put the corresponding brain maps again here. So we have from the eyes open segment the alpha 1, alpha 2, and alpha brain map, all of them having the same scale. So we can directly see that there is more alpha 1 compared to alpha 2, because this is green, yellow, and red, and this was blue and a little bit green. So we can visually see that there is more alpha 1 compared to alpha 2. And this also shows in our value, and this also shows in our score. This is why it's red. So for focus, we basically have these 4 scores that we are looking at. Theta, theta beta, relative theta, theta beta ratio, relative alpha, and alpha 1 to alpha 2 ratio in frontal, central, and this one also in the parietal region, because we often see this also with when there are problems with sensory processing, but I will get to it. We do have a specific score for the parietal cortex to monitor sensory processing issues. And as you can see again, and I'm also like, if you can't grab everything from this webinar, this is a sample report that we can send to everybody who is interested, and so you can just read up how these scores are calculated. Nothing secretive there. In the original report, you will also always find some references on the bottom to see where we draw this information from. Next, we also check for over-arousal. So we specifically compare high beta to beta ratio on CZ and FC. So we're checking for a frontal or central over-arousal to see if this could be an issue. So in this case, again, we show you the power of the eyes open beta and high beta. And here you can see we have more beta, which is mid beta, ranging from 15 to 20 Hertz. Our high beta is defined as, 12 to 20 Hertz. Our high beta is defined as 20 to 35. So here you can visually see that there is more beta compared to high beta. So there might be still some higher arousal due to the beta, but it's not more high beta than beta. So we expect that this is an efficient arousal level and not inefficient. That's also why the quotient is quite low and our score is in the green. About the scores, I often tell people let's say a good subject for neurofeedback is when you have, let's say, most of your scores green, but maybe 2 yellow and 2 or 3 red, because that means we have a very specific target to work with. So that's the best case. So the scores are meant to give us a target to work with neurofeedback, and this is exactly what the webinar today is about. Figure out what we work with. So it's totally normal that somebody with issues does not have all scores red. So in best case, we have some green, some yellow, some red, right? Okay, so that's the overall arousal score. I hope it's easy to understand. Sensory cortex. So as I mentioned, we do have a specific score for the sensory cortex that looks at alpha 1 to alpha 2 ratio. Here again, we're looking for alpha peak basically and the ratio of alpha 1 to alpha 2, but this time specifically on the sensory cortex. And here it's the same thing. We would expect this to be somewhat balanced with eyes open. So we'd expect roughly the same power in alpha 1 and alpha 2. And in this case, though, we can see that there's more alpha 1 than alpha 2, which also shows in our ratio, which is 2.3. And so this is why the score is red. Motor cortex. So maybe one side note. Currently, we have this score for sensory cortex. We might implement a score that goes for the specific over-arousal level of the sensory cortex. So we might do something like an beta to alpha ratio but this is something where we do not have any reference data yet, or at least no data that seems to be good enough, statistically good enough to use here. So we do not have a specific over-arousal score for the sensory cortex yet, but it's something that I'm looking for, that we're trying to create and implement as soon as we have a good setting. I mean, you can always calculate all that yourself, but the score should also give you a somewhat of a range where we would expect the value to be. Motor cortex. So we're also looking for a specific mu rhythm, which is an excessive alpha power, specifically on C3 and C4, which seems to be linked to the mirror neuron system. It seems to be also for a lot of motoric agitation. So it's not, let's say, a proof for ADD or ADHD or a specific marker, but it seems to be somewhat correlated at least. So I'm observing this marker, but it's not that I am, that I don't know, I would need to get a little bit more research on it to see how valid it actually is. But still, we put it in there. So we would expect, especially in a calm resting state on C3 and C4, to see specifically high alpha. And as soon as people start moving, for example, their hands or legs, this should totally disappear. So as soon as the motor cortex is used in any way, this rhythm disappears. So it's important to make sure that during the recording, we actually do have a resting state. So in this case, we see maybe a little bit of alpha, but it's not specifically high. So if you're looking at a brain map of someone with a significant mu rhythm, you will see really like red dots on C3 and C4, specifically in the alpha range. So in this case, it's lower, the relative power is lower than 20%. So it's not something that would score as yellow or red. All right, so we're more than halfway done already. You're getting there, yeah. Frontal alpha asymmetry. This is also a parameter where I feel like we need more research on that. The idea is that we would expect the left frontal lobe to be a bit more active compared to the right frontal lobe. There was some research done by Davidson, and he is also the one who issued this A score. That's how it's sometimes called. So it's a specific formula, but we just took from the research paper, which kind of looks at, is there more alpha on the right side than on the left? That's how it should be, I guess, or is it the other way around? And this is a marker that seems to be associated with depression or affective disorders. So, so we are also calculating that parameter, and then we are looking at a specific value, and then we score that. So this is not a parameter that I work a lot with in neurofeedback, but it sometimes shows up in literature. That's why we also included it here in the scoring table. Alpha regulation, eyes open versus eyes closed. So this is a parameter that will take into account two different segments. If we look at the eyes open and at the eyes closed segment, we would expect alpha power to go up with eyes closed due to the visual cortex reducing its arousal level. So we would, that's why we compare the eyes open alpha brain map and the eyes closed alpha brain map with the same scale. And then we're looking at the increase on the position PZ in this case. And then we give you a percentage. So in that case, from eyes open to eyes closed, the alpha power, the relative alpha power compared to each other, not in total, but compared to each other, increased 46%. So that's a green score because we were looking for an increase of at least 30%. That's what we expect. If this does not happen, it can be an indicator that there is a lot of eyes closed over arousal, like we see in post-traumatic states or things like that. Theta alpha ratio with eyes closed. So with eyes closed, we expect the brain to slow down a little bit, especially in the parieto-occipital lobe, but it should not drift totally into theta state. So we would expect alpha to be more dominant than theta, actually, at least at the beginning, unless we specifically try, for example, with alpha theta training to slow down the brain. So we are looking at the ratio of theta to alpha. We also give you the brain maps to have a look at it. Here's an artifact. That's what the red dot is. Usually we remove artifacts, but it doesn't always work perfectly, to be honest. Something we will improve in the future. And so here we get a value of 1.1. So we have a bit more theta compared to alpha. So this gives you a yellow score because it means, you know, alpha is not the most dominant activity, it's more in the theta range. So this could be a person for an eyes closed alpha go training with a theta stop, for example, to get more significant alpha state and thus maybe improving the ability to relax. All right, almost done. So we also look for the frontal to parietal asymmetry in alpha. So as I mentioned, we would expect with eyes closed to have in the parieto-occipital lobe more alpha than frontal lobe. Frontal lobe alpha could indicate an under-arousal of the frontal lobe and thus could mean rumination, depressive symptoms, trouble falling asleep. So we would expect these to be somewhat balanced, or rather have more alpha in the parieto-occipital lobe. So that's sorry, I didn't paste the screenshot here. So that's what we are looking for in the score. We're building that ratio, and then we are checking, you know, is the parieto-occipital lobe more dominant in the relative alpha compared to the frontal lobe. Two more scores that we're looking at. So one is the excessive delta. That means we're generally checking for on the 7 positions for high delta activity, specifically because it can be an indicator for traumatic brain injury. So if we see a lot of delta waves that often do not show so dominant on the raw EEG, because this is always like recalibrated. So often in the brain maps, we are surprised a little bit by that. And then it looks like this. So in this case, we see that we have average delta, relative delta power with eyes open of roughly 40%. So that doesn't score because anything above 65% would be considered potentially pathologic. So that's all good in this case. And then we do EMG artifacts on T3, T4, FP1, FP2, so specific positions for musculus frontalis EMG or a musculus masseter EMG on T3, T4. We could also do O1 or O2 for a neck tension in the muscles. So far we have implemented these 4. I mean, we could add the other ones as well, but at this point we haven't. So maybe also something that we will do in the future. All right, and that's how this looks like. So we're also going for a cutoff of 15%, but yeah, if there's not more than that, then we don't go over it. Okay, these are all the scores. Now let's jump back to our initial, and then I have a few more minutes, but I think we're good on time this time, so we also have enough room for your questions. So in this case, let's look at the scoreboard that we have for this patient. And so I would say this is maybe a good person for neurofeedback, and here's why. So we see some red scores, and we see some green ones, and we see some yellow ones. So that's already an indicator that our recording and the analysis is specific. Because if everything is red, then maybe we did a bad recording. If everything is green, I had some people where that's actually the case, then maybe everything is good, but then we do not have a specific target for neurofeedback. So let's see if these scores kind of make sense. So we have a patient that does have excessive theta and also has a high theta beta ratio. So since these two are very similar, I would say that makes sense that they are both in the red. So it seems like down training of theta in FC or CZ could be a good indicator for this person. Alpha seems to be okay, but we see that there is a problem with alpha 1 to alpha 2 ratio. So while we do not have to inhibit the full alpha, we might have to inhibit alpha 1 specifically to work on this parameter. And sensor performance score, if you remember, was also alpha 1 to alpha 2 ratio on the parietal lobe. So we have 2 indicators for an high alpha 1 power, and we have 2 indicators for high theta. And then we can see the alpha regulation score from eyes open to eyes closed is also scored red. So it seems like the alpha regulation is disbalanced. And when the person closes his eyes or her eyes, there's not significant alpha showing up. And we see that also with eyes closed, we have too much theta and not enough alpha, because this one is also red. the rest seems to be okay. So I would say this is a good example for neurofeedback because we have, I would say, two parameters to work with. We can do a focus-based training with eyes open that would inhibit theta and inhibit maybe alpha 1 additionally on the position FCZZ, but this one could also be on the positions P3, PZ, P4. So we could also split this in two trainings to not work on too many lobes at the same time. And we do have an option with eyes closed to do an alpha reward training and theta inhibit training because we would like to move his eyes closed EEG more towards alpha and not so much in the theta range. So I would say it's a very good example for a specific neurofeedback training that shows us that this person is tending towards under arousal. That's why with eyes open, we see red scores in the theta and alpha 1 parameters. And with eyes closed, we see red scores in the theta to alpha parameters. So these could be two, or if we split the positions here, 3 specific neurofeedback trainings that we could work with. Almost done, because now, of course, this was a lot of stuff, but we're also trying to help you understand, sorry, go back here. So what we currently do, but we are reworking this as I speak. I will show you, give you an overview on how this will look like in the future. So what we do now is we give you at least a rough direction on what to work with. So is it rather a general calmness protocol? Should you go for a focus protocol, or should you go for a relaxed protocol? So in this case, it makes sense that we do not have any high beta over arousal parameters, no excessive delta either. So it makes sense that this score is quite low. We do have points for focus. So this seems to be a promising training direction. So it could be, as I said, theta beta ratio training or something like that. And relax means all trainings that are here to improve, to increase alpha power, alpha frequency bands. So usually done on the parietal positions. So this is, and in the BrainAssistant, you will find these keywords on the protocols that you can select from, so you can pick the right protocols. So to give you an example, how we could do that is that we go, for example, here, and then I say, I want to select a protocol for neurofeedback. And then sorry, it's in German, but in English it will be very similar. So now I can see my training's goal is focus, and then I will get all the protocols that I usually use to train focus. That's what we do right now. And don't worry, Beatrice, I'll be done in 2 minutes, so I'll be on time. This was our first version of the protocol suitability score. Again, we're trying not to say protocol recommendation because it's your job as neurofeedback provider to pick the right protocol. We're just trying to help you figure it out. The next version, and this is not released yet, so I'm giving you a sneak peek of a feature that we are currently testing, will look a little bit more like this. So what we will do is that we actually will show you the scores, as I said, in an inverted way. So we will not have the red one here with 100, but it's the opposite. And we will also group it to certain scoring categories. This will probably be 7 at the end. So you can quickly see what this person is missing. These are different data sets, so it's not the same that I just looked at. And we will try to specifically recommend, or at least give a scoring system that specifically gives you certain protocols that could make sense for this person. Again, this is just a mock-up, or let's say a demo with which is not finished, so it doesn't make sense to have left hemispheric activation if this person is missing regeneration. But this is what we're trying to do. The, let's say, 8 to 10 most commonly known neurofeedback protocols, we will pick them and try to put them on a scoring matrix, and then use the scores to tell you or to give you an indicator, hey, for these scorings, this protocol could work well. And of course, we hope you will still open your BrainMaps manually, go through them, have a look at them. But this is basically an idea, or the process that I have done manually over many years, condensed in an automized report generation that will specifically look at specific BrainMap settings with specific ranges to then figure out if a parameter is in a range that we would expect or if it's above a range that we would expect. Right now, it is based on research and hypothesis and also our own data sets. The next iteration will be, and this will be a project of 1 to 2 years, that we will actually use big data approaches and machine learning to make this better, more reliable, and give it more confidence to actually do scores and recommendations. So we will, for example, then look at people that are specifically scoring well, for example. So in these scores, we'll also have something like the cognitive test, like Stroop test, CPT, which you can do directly in the BrainAssistant. So we'll also have scores of these tests, cognitive tests, and EEG parameters. And then we, for example, analyze only the data of people that are doing very well in the CPT or Stroop, check out their EEG, and then we learn a little bit more about which parameters are, for example, very prominent in people who have a fast reaction time. And then we can train the system to get better and better. But the idea will stay the same or be very similar. So this is currently in testing and will be in one of the next releases for our users. And of course, you will also be able to print this to a report for view to print it out for your clients and patients. Okay, that's it. I'm done with the presentation. So as I said, it was, I guess, a lot of input. I wanted to give you an understanding of that. And also, like I mentioned, all the scores do have an explanation on why or how we calculate them, and also give you a rough idea about what you will or what it means if this shows up. But we also try to always be careful, because we cannot just put there, this means this person has ADD or focus issues, because there are always some outliers that are not consistent. All right, with that, Beatrice, or to the audience, feel free to ask any questions and forward them to me, so we can see if, or also some feedback and criticism, always welcome.